Still unpacking crime statistics here on SABC News Channel. The Full View, we've been taking you through the statistics as announced by the minister earlier on. We are speaking to David Africa, who is the Executive Director at the African Centre for Security and Intelligence Praxis. So the minister says if you look at the overall statistics, crime has gone down by 14.4%. Over the quarter. But you were saying, Mr. Africa, before we went on air, that we've got to be careful on how we calibrate the figures, that this thing of releasing on a quarterly basis these figures doesn't really give the full picture. So then does that mean that you disagree with what the minister also then posits, that there is a decrease, especially in contact crimes, due to effective policing?
No, I don't disagree with the statistics. I mean, they speak for themselves. And in South Africa, the statistics are quite reliable, the crime statistics, especially for the more serious crimes like murder and attempted murder and so on. So there's no disagreement there. What I'm saying is two things. Firstly, when we look at the big picture of crime and how people are affected on a day-to-day basis. When you go to a township and you feel the pulse of the community, then this 14%, which is a general decrease over categories, is not significantly felt by a community. Remember that the statistics go up and down, and so it's a sort of seesaw effect. And the second problem I have with the statistics, I mean, with the obsession with the statistics really, is the fact that our baseline, of what we would regard as acceptable has now become so low that, we would be quite happy, as one should be, with the most minutest reduction, for example, in murders. But we as people, South Africans who are concerned with living safely and securely, we need to find ways of fundamentally altering the state of insecurity in the country. That is my contention.
Okay. I want us to put up a graphic so that we can talk over some of these figures. And I want us to also have a conversation about the notional picture that these contact crimes have gone down, and compare that with the lived experience of people. Lockdown is being seen, for instance, as a deterrent. So why is it that we see more of some crimes than others? So what we're looking at first, as you can see, there is a murder, sexual offences. So if you can just talk us through that.
I can't actually see I can't
okay,
see
so we've put it up for the viewers so they can see it, but I want you to talk to me about the fact that there is this notion that some of these contact crimes which we have up there have gone up, but that against the background of the lived experience.
Yeah, obviously, we've been in lockdown for the last year, and because of, if you look at the violent crimes, the contact crimes in South Africa, they occur in usually, social settings. So these would be where significant numbers of people are congregating. That obviously we've seen a reduction in that kind of social interaction over the last year or so, more than a year now. And so one would expect that because of the location of these crimes, which are social setting crimes, that there would be a reduction. It's welcome, obviously, but we can't live in lockdown forever in order to bite off chunks of contact crime. And so, and this is one of the reasons why we have to look into what are the causal explanations for a reduction or an increase in a particular crime statistic, so that when that particular situation no longer exists, I mean, we are already coming out of it now. Will we continue to see a decrease? Or are we prepared then for for a changed situation so that we don't see an increase again now?
So there were reportedly 387 more people killed compared to the corresponding period in the previous financial year. But I want us to focus on sexual crimes and the definition thereof. We also know that there is an underreportage of some of these crimes because people don't have faith in the police, the experiences that others have reported having back. So let's talk about some of these challenges.
Yeah. So if we look at gender-based violence against women and children, we have an excellent national strategy of how to deal with it. But obviously that strategy only works when, firstly, there's commitment to make it work, and secondly, the necessary resources are committed, but also the necessary skills are developed, and the skills and attitudes really at the local level where people would interface with law enforcement. So, your local police station. We know that it is often the case, not always, that women, for example, will go to a police station or call to report a sexual assault or violence, that they are often told that this is a personal matter, sort it out between yourselves, and so obviously, a problem there is that the scope of this violence is so huge, violence against women and children, that this excellent strategy that we have to really put in the huge amount of resources, and it is huge, but we must commit these resources so that in the end, the strategy must be realizable at the local level. And we don't see that. It has to do with resources, it has to do with skill, and quite honestly, it has to do with attitude, with the fact that often a woman is just ignored or is assumed to deserve it, or that it's a private matter in a sense. And I personally, I don't witness the upskilling that's required. I don't witness the investment in skill that's required. The establishment of special units to look at violence against children and women, and the resources.
It's such a pity that we have run out of time. I really wish we had more time because there's a lot to talk about, including the challenges to sector policing. But thank you so much, David Africa, Executive Director at the African Centre for Security and Intelligence Praxis. Thank you so much. Now, a third wave of COVID-19 infection has hit Gauteng. That says Premier David Makhura. This week alone, he says the number of new cases in the province has more than doubled. He announced this at the official opening of a 181-bed refurbished mining hospital in Carletonville, west of Johannesburg. There are currently 6,712 active cases in Gauteng.
These are the scenes the SABC filmed just this week in Mfuleni in the Sedibeng district. It was announced at the time that the area was one of several that was fast approaching the third wave. There was little to no compliance, no social distancing, and you could count the number of people wearing masks. Now the country's economic hub has been hit by a third wave of infections.
But we in Gauteng have arrived at the third wave. Just by looking in 4 days, doubling up the numbers, the daily infection rate increased almost double in a period of a week, from around the average of 300,000 to the average of 600,000. But in 2 days, between then and now, we had a sustained increase of cases that in 2 days, our cases have been above 1,000.
Makhura says because the numbers are alarming, he wants stricter restrictions in the province, but not a total shutdown of the economy.
We are a province that is in the heat at the moment. We are in the face of fire. The storm is here. Yes, we would like a situation without shutting down the economy. There are measures that we would like to be stricter regulation and restriction measures that we would like to see, because people are no longer observing the fact that there are regulations.
Makura announced this during the opening of a refurbished mining hospital, which is expected to bolster efforts once the numbers increase. With the province's COVID-19 numbers expected to escalate, the 181 beds at this facility will come in handy. 460 million rand is injected into this project as a response to the pandemic. The increased number of critical care beds will also come in handy in the long term for the West Rand. Gauteng has been put on high alert, and law enforcement agencies are expected to reinforce compliance from this weekend. Criselda Lewis, SABC News in Carletonville.
Meanwhile,